Everybody, in this particular lesson, I'd like to focus on something quite interesting, and that is going through the different types of interview questions that have been asked recently in medical and dental school interviews. And I feel that this particular lesson is particularly interesting and insightful, as it will provide you a better idea of how the interviewers are aiming to tease out the traits in you. So what you have in front of us is the very first type of interview question, and that is personal style questions. So personal style questions focuses on the candidate's opinion about something in relation to themselves, without any particular reference to a necessary event or time period. So these questions are generally more vague, and the classic question would be, tell me something about yourself. I mean, that's a super vague question. And you can take obviously a lot of different ways in terms of how you want to answer it. Another question would be, why do you want to become a doctor or dentist? Depending on the interview that you are sitting. Another one would be, what are your top 3 weaknesses? What are your top 3 strengths? What are your hobbies? So the challenge with these types of questions is that because of its vagueness, the candidate is forced to really take an extra step of consideration in determining the specific context they want to answer this question with. So for example, if we're talking about hobbies, you need to come up with actually a hobby first before you are able to then discuss it in sufficient detail for you to actually start portraying certain traits. So for example, you have to actually think of a memorable hobby that you actually do genuinely and enjoy a lot. And from that, let's say it may be playing soccer with their friends in the local park on a Sunday afternoon. When you have examples like that are genuine, memorable, and obviously, like I said, something that you enjoy, you then can have an easier time expressing why you enjoy it, and the reasons for why you enjoy it could be the teamwork, the camaraderie, the socialization, the effective communication that you develop through working with your friends, competing with each other, or competing at a, for example, social level. That may be what makes you tick and what makes you want to constantly go back. So obviously we can't just list out these traits like that. We have to actually develop them further, which we'll talk about later on, in the video, how to prepare for interviews. But that's the idea. The idea is to select a context that allows you to easily set up traits that you know the interviewer is interested in as goals for your response, so that by the end of your answer, they will feel that the candidate sitting in front of them not only has these traits, but has a great deal of it and has the version that suits their selection criteria. So the second type of interview question is what we call the event-specific question. And event-specific questions are similar to personal style questions in that they ask about something in relation to yourself, but in this case there is a very specific focus on a particular type of event and the time frame. So questions could be, tell me about your greatest accomplishment in the last 12 months, or maybe tell me about your greatest failure in the last 12 months. It could be, what are you most proud of in life thus far? It could be anything that really focuses on you going through a particular experience and how that experience made you feel or change you in some way. A common one would also be something along the lines of, what was the biggest challenge that you faced in the last 12 months in schooling? Things like that. So again, with this type of question, you do need to set up a bit of a contextual reference depending on the particular context or event that the question is asking for, but you do not absolutely need to explain the whole story. So for example, if you're talking about study difficulties as being a major challenge, you don't need to list out and explain all of the challenges. You want to pick out the event that highlights the difficulty the most and explain maybe what that difficulty is, which may be, for argument's sake, time management, right? Organizational skills, which fundamentally is about how responsible you are for all the different types of things you need to be responsible for, whether as a student, as a part of your family, also maybe making income for yourself, own expenditure, lifestyle, things like that, will allow you to then talk about why each of these traits are so important and maybe what you've done in order to improve to benefit yourself in becoming more responsible as an individual. So the main thing is not to storytell, not to do a massive recall of every single thing you've done, but really focus on one or maybe two very specific parts of the experience. So if you think about a big experience, the particular part of that experience that best highlights your traits. So that's event specific. Conflict specific is the next type of question commonly asked in interviews. So like event specific, they focus on a particular event within the particular time frame usually, but often it's to do with some kind of interpersonal conflict, right? So for example, one question would be, tell me about a time where you accidentally offended someone. Tell me about a time that you felt really guilty about what you said to someone else. It could be, when was the last time you had an argument with your friends, with your parents, and what did you learn from these experiences? So that is typically a conflict specific type question. You could also get into things that ask specifically about conflict resolution within a certain environment, such as school, such as work, where maybe instead of you initiating conflict or you directly receive conflict, you managing that conflict as a third party coming in between, let's say, two friends. So again, this question plays a very important part in helping you get across certain traits, and often than not, we're looking at things like effective communication skills, right? Because conflict is often due to a lack of effective communication skills, and maybe through you then realizing that, how would you change up your way to be more effective? That could be how you talk about things. Another one is often conflict arises due to lack of empathy, and although the message may be correct, technically speaking, it may be the fact that the way that it was spoken wasn't sensitive enough for the recipient to wholeheartedly receive the feedback. Okay, it could be something like that. But again, you do not need to explain the entire story. You need to talk about the overview and then really quickly dive into the part that's most relevant to help you convey your traits. The fourth type of question, ethical question. So ethical or contentious style questions are quite different to the first three. The first three are what we call more behavioral type style questions. Ethical questions focuses on a societal or community opinion or view and asks you for your own. Okay, so this is when you're asked about questions such as, what are your thoughts on the legalization of marijuana? Do you disagree or agree with this action? What are your thoughts on active euthanasia? Do you disagree or agree with this basically action? What do you think of the current president of the United States of America? What do you think about the current Prime Minister of Australia? What are your thoughts on various things like legislative moves, things that maybe are even in the news at the moment? How with the coronavirus, what's your stance on whether or not action should be taken for, let's say, China, okay, where the virus originated from, to compensate for whatever happened there that led to the economic collapse of countries in the rest of the world. Questions like that. So with these types of questions, people tend to get really, really stressed out because they feel they don't know much about these issues. So you do need to know a certain amount of this issue and why people are having the opinions they have. So really, it's just more of a basic understanding of what the issue is and why people have certain feelings about these issues. You're not actually meant to go into the interview and tell them every single fact that you know about the current legislation to legalize marijuana. Like, that's really not the point, because that becomes then a knowledge-based assessment, which interviews are frankly not. If that's the case, they will just get you to write an essay, okay, about the legalization of marijuana, and you're done. The thing about ethical questions is that they are really there to see whether or not you are the type of person who problem solves well by looking at the crux of the issue, the variables of the issue, whether you're able to consider them logically, constructively, whether or not you are able to understand and appreciate, not necessarily accept, but realize the different views of other parties, and how you are able to come to a certain response. And it's not like they have a big list of ideal responses, and that if you said yes or no to a certain legalization of something, okay, like marijuana or active euthanasia, that you're automatically a good or bad candidate. So it's really not about your final response as whether or not you are pro something or you're anti something. It's about how you explain your thought process and what you considered, what you haven't considered, which will showcase to the interviewers more about the thinking process that you have and therefore the problem solving process that you have, but also the stance that you take and why you take that particular stance. And again, it all needs to be very much catered for how you are then going to exhibit the traits that you know they're looking for. So a part of it could be the fact that when you answer the question about, let's say, the importance of whether or not marijuana should be legalized, it could be about first, and here's the thing, with all ethical questions, they never give you all the information anyway. So there are things that you can say. You can say things like, well, first and foremost, I'm not an expert on this issue, but I do know of its existence. But for me to really understand whether or not the legalization of marijuana is applicable for Australia as a whole, I need to really see right now who needs the legalization of marijuana and for what purpose, and are there any other alternatives, and what's the impact, what's the benefit or risks associated with legalizing it. I mean, is it really something that everyone needs, or is it more for particular target groups? Because through this process of research, you become a more informed individual to make a more well-informed and thorough decision. And that's maybe part of your decision-making process, which includes good problem-solving skills. So that's maybe how you can intertwine your traits into responding to the question. But really, it's not about your final opinion. It's really about the fact that you have justification, and justification is what you've considered and the traits that you want to embrace. And maybe there are values in here that you can include as well, right? That could help in showcasing the type of person you are, which matches that of the selection criteria. Now we've got the next type of question, and this is the fifth question type, scenario-based questions. So scenario-based questions are commonly used in MMIs, but also in sometimes semi-structured interviews. But we've actually reviewed one beforehand in another lesson, and this one I'll just read it out again. You're a fourth-year medical student who have just commenced a placement at a local hospital. You're required to observe the day-to-day tasks of doctors for clinical exposure in the workplace. However, as you follow Dr. Olson, the registrar, and sit in his consultations, you realize that he consistently acts in a condescending and dismissive manner to patients of Asian descent. In addition to constantly talking over the patients, Dr. Olson also talks down on the effectiveness of traditional Oriental remedies. You have also heard him muttering indistinct comments after patients have left the consultation. What do you do in this situation? So, this is a classic scenario-based question, and obviously there's variations of this. But the main thing about how I look at scenario-based questions is that there are always multiple characters at play. And when you look at multiple characters, you've got to look at, for example, you as a fourth-year medical student, Dr. Olson, patients of Asian descent, right? Those are the three obvious immediate characters in play. You then need to recognize the role, okay, of each of these characters. So, for example, you as a medical student, you're there to learn. So what's your priority? You're there to learn, best practice in terms of medical best practice. Dr. Olson, what's Dr. Olson's job? What's their priorities? In terms of this patient of Asian descent, okay, what are their priorities? Or what is his or her priorities? So when you're talking about it from that angle, you're able to segment your answer to focus on the perspective of each of these characters to then create additional opportunities for you to discuss traits that are unique to each character. So that's a good way to organize your response. But at the same time, the thing about scenario-based questions is that they always try to tempt you to make some assumptions, because every single scenario question never has the full complement of information you need to make an outright decision. See, a lot of people are tempted to think that Dr. Olson is definitely in the wrong in this case, without actually knowing, for example, why he does the things that he does. Or, in this particular case, maybe it's the fact that you haven't really seen Dr. Olson, practice with other patients of other ethnicities more. Maybe this is just how he talks, okay? Or maybe there's a deeper issue. And these things are not discussed whatsoever, right? These things are not discussed whatsoever. So a part of scenario-based questions is actually becoming more informed about the situation, because there's plenty of holes. I mean, if you look at the scenario right now, that's hardly comprehensive. I mean, if you imagine it to be real, there will be a lot more detail, and in this case is always omitted. And when the question asks, what do you do in the situation? Again, it's not really about what you will just straight up do in this situation. It's about why you would do certain things. And you might look at your actions differently depending on what you find out. So you might say, well, if what we discovered through maybe talking to colleagues of Dr. Olson or other medical students about Dr. Olson's behavior, that realized that Dr. Olson actually does this for this reason, or does this for reason A, B, C, D, that for each of these reasons I'll approach the situation in different ways in order to help the situation get better. Whether it is the fact that Dr. Olson needs a bit of a reminding, and that it maybe shouldn't come from a junior, in this case a medical student, maybe someone senior as well, you go by a different pathway. Maybe it is something that Dr. Olson just kind of does because of his unprofessionalism. Maybe Dr. Olson has very bad experience in the past, or maybe was just really not good at explaining things to patients in general. Whatever it may be, you have to take different approaches. But it's really not about the actual actions. It's about, again, the reason, behind why you would take the course of action. And that's when you integrate your traits into that as well. Finally, we get on to the last interview question type, and that's called role play, or I like to call role play / teamwork / debating / puzzles. Because those types of interview questions, this type of interview question covers a whole lot of them. So it's basically like a miscellaneous group. So role plays, or acting stations, sometimes they're known as, focuses on you actually doing something, or quite literally interacting with an actor. And these are usually MMI only. So when you're sitting outside the room for the station you're in, you're given an excerpt such as this one. You're a doctor whose longtime patient, Fred, has just passed away due to his complications of diabetes. Fred was 82 years of age and leaves behind his wife, Dorothy. Enter the room to talk to Dorothy about this matter. So here's the thing. You walk into the room, and the interviewer is usually sitting in the corner somewhere, or somewhere else in the room, observing you. And in front of you would be a professional actor, Dorothy, who you now need to talk to. So the funny thing about how students approach role-play acting style questions is that they already have a preconceived idea in terms of what this person will be like. But you don't actually know until you see the patient. So see in this case Dorothy. So in this case, it's a big part for you to actually showcase your effective communication skills, showcase your sensitivity, showcase your rapport building. And that's not only through asking questions and telling them what's happened. It's really being able to sense out and gather more information as you go about the person in front of you, so that then you can act in an appropriate way. So a lot of this is actually trying to get to know the person before you know what to do. Right, and you're only given maybe like 8 to 10 minutes to work with this particular actor. And the way that your traits are assessed is not only through what you say, but your actions. Like literally, what do you do? Like if the person is really upset, how do you comfort them? Right? Is it appropriate in the way you comfort them? Do you offer them a chair? Is there a chair in the room? Like what do you do? So, the best way to treat a role play style question is to be absolutely genuine about what you would do if that was something for real. So that's really what we're talking about. They're observing how you act according to the traits that you should have possessed inherently. And it's a really good way to see how you would go about things in a, candid, that's what we used before, the candid or brand new situation, and put you on the spot a little bit. So likewise, you've got similar interactive, types of questions within this miscellaneous group. Debating is when you might be given a topic and you have to debate the topic against a interviewer and about a certain side for the topic. So you might be getting the against, and the interviewer might be getting the for. And it's not so much you try to out-debate them as per se, but you're trying to listen to their points of argument, and then from that, courteously, obviously, respond in such a way to address other aspects that maybe the interviewer hasn't realized, right? But it's about maybe listening and going back and coming up with a plausible solution. So again, it's very active, and it's all about demonstrating the traits. So miscellaneous group, okay, it's all about demonstrating, literally doing the traits, not just talking about them anymore, like what you have for the first 5 types of interview questions. Then you have team-based, usually puzzle stations, where a group of candidates work together within a time limit to solve some kind of physical, like 3-dimensional puzzle. Again, how you communicate with others, working together, not just taking the lead and leaving everyone in the dust. Okay, is a good way. Is a good way for the interviewers to see how well you will do when push comes to shove in a team setting. So all these different types of questions are really more new types of questions to help interviewers better assess the traits that they want to see. So just going through these question types, I hope I've given you a pretty good idea of what interviews are interested in and how they're providing you these opportunities. And one thing that is absolutely paramount is for you to obviously know what the traits are, and often they're not. You can actually find them on the interview page of the medical or dental selection process on the university website, and they will have key criteria listed out. They may not have all of them, but you'll usually have at least 3 to 5 of them for you to get a better idea of what their main focuses are. Then it comes down to understanding the opportunities that the question provides you through learning how to dissect them before you're able to set goals to your current response, so that by the end of your answer, the interviewers will feel the same way about what you wanted them to feel about you in terms of the traits that you exhibit, that you have not only a lot of it, but also it's been tested, it's been worked on, it's been developed, and that you have the best version that is suitable for medical and dental practice. So it's quite an interesting mixture, but at the end of the day, I haven't personally seen any other question types beyond these. And if you're able to get familiar with every single one of these question types, no matter what question they throw at you, and here's the thing, they never really repeat specific questions except for 2, which I mentioned before. Why do you want to become a doctor, and why medicine or why dentistry at this school? Besides those 2, none of the other ones are really repeated ever anyway. It means that you can be constantly adaptive and having good interviewee skills to make the most of every opportunity you get. So hopefully that was interesting, and now it's getting you to kind of think about what interview is really about, for you to get a better grasp on how you should be preparing.